Hello everyone and welcome to this video. This is the first in our series on the benign tumors of the epithelial tissue origin, where we'll be talking about the squamous cell papilloma. If you want to watch more of these videos, please hit the subscribe button, and without further ado, let's get right into it. Now, starting with squamous cell papilloma, to be honest, its name is quite self-explanatory. The squamous papilloma is a benign human papillomavirus-induced proliferation of the stratified squamous epithelium, resulting in a papillary or verruciform mass. So the main culprit here is the human papillomavirus, and the victim here is the stratified squamous epithelium. The most commonly identified strains of the papillomavirus here are 6 and 11. And unlike the other human papillomaviruses, they have a rather low virulence and infectivity rate. Apart from that, this is a common occurrence in the oral cavity, and it accounts for almost 3% of all the oral lesions submitted for biopsy. Its clinical features include no specific gender predilection. It can arise at any age, even in children, and often occurs between the age of 30 and 50 years. The main site of occurrence, it can occur anywhere in the oral cavity, but the main site of occurrence is in the palate, the tongue, the lips, and more importantly, it is the most common soft tissue mass arising from the soft palate. In its presentation, it presents as a soft, painless, usually pedunculated exophytic nodule with numerous finger-like projections. So what this means to say is, if this is the epithelium, it tends to grow outwards in an exophytic manner from the surface of the epithelium, to which it is connected by a peduncle or a stalk. So this is why it is a pedunculated exophytic nodule. Now it has numerous finger-like projections on its surface that imparted a cauliflower or a wart-like appearance, as you can see here. Depending on the amount of keratinization, it may appear white, slightly red, or even normal in color. And it usually appears as a single or a solitary lesion. It enlarges up to a maximum size of 0.5 cm with no change thereafter. Some of the lesions, there might be an exception, they might grow up to 3 cm even, but usually this is how it presents in the oral cavity. Now, the important thing in its clinical presentation is its close resemblance to Verruca vulgaris or the common wart. This is more commonly seen on the skin, and unlike papillomavirus, it is associated with the strains 2, 4, and 40. These are highly contagious and are capable of spreading to different parts of the affected person's skin by the means of auto-inoculation. And to the oral cavity, it might be through finger sucking or fingernail biting. Before we move on to its histopathological features, there is an important thing that I want to mention, which is papillomatosis. Now, papillomatosis or multiple papillomas, they sometimes, when they occur together, they coalesce together, forming a large lesion. And this is known as papillomatosis. It is seen in various syndromes and conditions such as Unis lateris, Gall-Scholz syndrome, Down syndrome, and Cowden syndrome. And a very important question here is the Cowden syndrome. Cowden syndrome happens to be a very important viva question that is associated with the papilloma, squamous cell papilloma. So I'll mention a short note about it here. Now, Cowden syndrome, it is an autosomal dominant inherited condition which is characterized by multiple hematomas. So simply put, it is an abnormal proliferation in a normal location. This is why it is also called multiple hematoma syndrome. Apart from multiple papules that are seen on the skin and primarily the facial skin around the mouth, nose, and ears, there is also presence of oral lesions, as you can see here, in the form of pebbly lesions at various sites. And there is also abnormality in the GI tract, the thyroid, CNS, and the mucoskeletal system. It is also associated with malignancy, and as written here, it might be a cutaneous marker of breast cancer. Okay, So Cowden syndrome or the multiple hamartoma syndrome is associated with squamous cell papilloma. Now in its histopathology, there are three key points. One is the proliferation of the stratified squamous epithelium. Two, there is the presence of a fibrovascular connective tissue core. And three, the presence of coeliocytes. So let's look into that. So here what you see are multiple thin, long finger-like projections. You can beautifully appreciate. These are projections of the stratified squamous epithelium. Each of these contain a central connective tissue core which contains nutrient blood vessels, which is why it is called a fibrovascular connective tissue core. Apart from that, some papillomas exhibit hyperkeratosis acanthosis and basilar hyperplasia and mitotic activity, and it should not be confused with epithelial dysplasia. The third thing, as I told you, is the presence of coeliocytes or HPV-altered epithelial cells. So what you see here are small dark nuclei surrounded by a clear halo, and these are seen in the spinous layer of the epithelium. Okay, and this alteration is induced by the human papilloma virus. Finally, the last thing is the treatment and prognosis. The mainstay of the treatment is conservative surgical excision, including the base. Okay, not through the peduncle, you do it through the base, and if done properly, recurrence is highly unlikely. I also mentioned to you about Verica vulgaris. The same approach is applied here. Apart from that, you can also go for cryotherapy and the use of keratinolytic agents. So with this, we come to the end of the video. Let's just quickly summarize what we have studied so far. We started by understanding squamous papilloma, where it was a HPV-induced proliferation of the stratified squamous epithelium, resulting in a papillary or verruciform mass. We saw its clinical features. We saw its presentation as pedunculated exophytic nodule, cauliflower or wart-like appearance. We saw it closely resembled Verica vulgaris or the common wart. We saw its associated syndromes, very importantly the Cowden syndrome. And also in its histopathology, we saw 3 points, which were the proliferation of the keratinized squamous epithelium, fibrovascular connective tissue core, and the presence of coeliocytes. In the treatment prognosis, we saw about conservative surgical excision. So with this, we have come to the end of the video. This was the first video on the benign tumors of epithelial origin. I hope it helped you in some way, and if it did, please make sure to like and subscribe and motivate us. I'll see you in another video soon, and till then, have a good day.